for joining me for another episode of the Seamless Connection podcast. I am thrilled to have with me today Dr. Nadine Hachach-Haram, the founder of Proximie and CEO of Proximie, as well as a consultant plastic surgeon and director of clinical innovation and strategic partnerships at Guy's and St. Thomas's NHS Foundation Trust, as well as still today a practicing NHS surgeon. So, Dr. Haram, such a pleasure to have you on the show today.
Thank you for having me. It's great to be here with you.
You have so many fascinating aspects of what brought you to where you are today. I don't even know where to start. So I love to maybe just have you introduce yourself to the audience and see what's most important to you as you introduce your story. Can you start with telling our listeners a little bit more about yourself and what brought you to where you are today?
Absolutely. Well, first of all, it's great to be here. And I think this podcast is great. So thanks for having me on it. I've listened to lots of the earlier ones and it's been very insightful. So yeah, my background kind of starts, I guess my why really starts with my childhood. I was born in San Diego, California, beautiful part of the world. And my family heritage is originally from Lebanon. And so when I was about, 9, 10, my family decided it was, important and time for us to move back home. My mom wanted to get closer to her family, aging parents, all that stuff. And it was a very interesting time to be making that jump. We left sort of very beautiful, sunny San Diego in the sort of late 80s, early 90s to kind of post-war Lebanon, which was just a complete culture shock for us as children growing up, to where we left an environment where we had everything, probably took quite a lot of things for granted, to an environment where even the simplest things, electricity, water, stable currency, all of those bits were not as available. And whilst it was a challenging environment from that perspective, I think it really opened up our eyes to the importance of community, of, giving back, of working together as families coming together. And in hindsight, it's probably the best decision my parents ever made. So growing up in Beirut in the 90s, wasn't always stable. There were still, outbursts of small wars and conflict happening in that region. And so you live life as if, every day or every week is your last. And you live fiercely through that, the way you express your love for your family, the way you give to your community, the way you, have fun. I mean, all those things, you live it to the extreme. And of course, that empathy of people around you becomes very, very palpable. And so growing up in that environment and seeing a lot of, unfortunately, sequelae of blast and trauma injury really affected me as a young teenager growing up. I could see children with burns contractures, missing limbs, you name it, and how it affected them in society. And I was, at a young age, I was about 14, there was a family friend who was a reconstructive surgeon from New York who would visit every once in a while. And I just boldly asked him, I said, would you mind if I joined you in your operating room? And he used to come and do mission surgery. So he would go down to these camp hospitals and do reconstruction. And I got to watch him. I distinctly remember this kind of 5 or 6-year-old girl. She had a burns contracture to her ankle, and he did kind of this very simple, in plastics, it's a very simple bread and butter procedure, but, for a 14-year-old, it was like the most amazing surgery ever, where he basically moved some skin around to help her get a bit more movement with her ankle. And I remember coming home that day and telling my mom, I know exactly what I want to do. I'm going to be a reconstructive surgeon. And there's no doctors in my immediate family. My parents aren't doctors. My mom was a teacher. My dad was a computer engineer. And we were 4 daughters. And it was just such a, when you just know what you have to do, it was so clear that that was what I had to do. And I was very lucky. I was raised by my mom and my grandmother. And my grandmother was incredibly passionate about community service. And so she taught us at a young age that whatever you choose to do in life, career or not, make sure that you do it with purpose. And as one of 4 daughters, so it was a very, patriarchal household, she also told us to always think big and not be stifled by the boxes or the stereotypes that people want to put us in, and that we could do anything we wanted to do. And that as a woman, having an education, having a job, having all those capabilities, would empower us to do whatever we wanted in the world. And so I went on that path, trained, I kind of continued pre-med in America, and then eventually landed in London for personal reasons, and trained in reconstructive plastic surgery. But alongside my training, I always made sure I was involved in global surgery. So for over a decade, I was traveling to different parts of the world, looking at capacity building and sustainability in surgical care, how we can help other geographies, accelerate adoption of new techniques, and ultimately serve, their people that had a whole range of complex craniofacial and other types of congenital anomalies that we could be helpful with. And I have to say, it was one of the best chapter. It was a great chapter in my life. We made such an impact on individual lives. At every mission, we'd treat anywhere from 20 to 50 children, and so their families were hugely, positively affected by that. But it was kind of 2014. I was kind of 10 years in, and the Lancet Commission had published that 5 billion people around the world lack access to safe surgery. And it was like a punch in the gut. I remember, sitting in my operating room, looking around the OR and saying, like, how is this gap so big? How can 2/3 of the world's population struggle to access surgery? Is it a people problem? Is it a process problem? What is it? And it's probably a combination of all of the above. And I started to think, is this really a global South issue or is it a global issue? And so I started to dig into the data more, and we identified, actually, we were seeing variability of access to care all over the world, even in the United States, between rural and urban, in the UK, between big cities and community centers, there was that variability of access. And if any of you have ever been into hospitals and operating rooms, these are hugely expensive assets for a hospital. A lot of investment goes into the infrastructure, the devices, the people, the training to get them there to deliver care. And at the heart of it is a patient that needs the best care the first time, every time. And so as I sat in my OR looking around, I basically could see this incredibly analog environment. Lots of expensive equipment sitting in corners, an expensive medical record system, greatly skilled and empathetic staff that wanted to work together to bring care, but there was no digitization across that. And we were seeing that it was taking almost decades sometimes to translate new techniques and new ways to deliver care. And so I started to imagine a world where you could create a digital operating system that would connect, collect, and activate knowledge, procedural data, information, operating rooms, bring expertise together to deliver best care to patients. And that if we could create this vendor-neutral, software-first approach, because there's a lot of hardware already cluttered in operating rooms, but if we could bring in a software that could connect the dots, lay the piping to enable that ability to virtually collaborate, to record and activate information, knowledge from that environment, and then hopefully generate insights that can either improve workflow, improve quality and safety, improve productivity, scheduling, looking at accreditation, quality, safety, that could really be a compelling way that we could address this gap, because there's no amount of organic growth of workforce that was going to address that 5 billion, but technology could be the enabler and could force multiply what we could do around the world. And when I started out, honestly, I had no experience in raising money, building businesses. I was doing this from a place of purpose, and so I thought, I'm going to kick this off as a research project. So I started to apply for grants, and no one was funding like digital startups at the time, or sort of ideas. And I remember I sort of told my husband, like, could you maybe, instead of a few presents, give me a bit of money to help do this, because I'm a poor training doctor with very little income. So he was very supportive, and started publishing papers, putting it in different environments. We put it in Peru, in a small town in Trujillo, to look at cleft lip and palate remote support. Put it in Vietnam, looking at craniofacial, in war zones, to see like how far could we push this technology from a connectivity, safety, security, infrastructure perspective. And it was only a couple of years later, so it was 2016, I think it was April or May, CNN published this editorial. Could this technology be the future of surgery? They'd caught wind of a story that we had done to support a trauma reconstruction case, found it compelling, and wrote this article. And suddenly my LinkedIn was like blowing up. People were reaching out. Are you fundraising? What's the name of your company? What, do you have a pitch deck? All of which was complete jargon. And I'm like, what? People actually give you money to take this idea forward, and they want a pitch deck? And I was like, this is incredible. I sat with my husband, who's in finance. I'm like, what do they mean? And he's like, wow, what have you gotten yourself into? And so, through that evening, he kind of walked me through like what that meant and the commitment it would mean. And Did I really, was I compelled to do this? And there was no doubt in my mind because I was seeing the impact firsthand of this technology, of how we were training more doctors, more nurses, supporting quality and safety and productivity, that someone had to build this category because it didn't exist. And the rest is history. And I can probably end by saying there are an enormous number of people at that time who told me I was nuts. This was never going to happen. How could me, as a female surgeon in London, think that I could change the world and sort of bring this technology to bear, and on and on and on. But several years later, the category exists. People have leaned into it. Hospitals are acquiring it. Med device partners are using it, and patients are getting the best care possible when such technologies are being employed. So it's been a great journey so far, but it definitely takes grit and perseverance. And I guess part of my upbringing enabled me to have that strength to do that.
So it's been about 10 years since you've been working on this idea, but how old is Proximie officially?
So officially, the company was kind of registered more around 2017, 2018 mark.
Mhm.
But yes, it was a labor of love and research for the years before that.
And how far have you come in terms of breadth and depth and scope of touch? I know you've been working on this globally, and you haven't focused just on certain the Middle East or Africa or anything. You've been going where the need is, really, as you mentioned, even in the U.S. and in the U.K. Can you give us some examples of how far you've been able to come with the impacts you're able to make?
Yeah, I mean, it's incredible. I would say we've been deployed in over 50, 60 countries around the world. Our biggest footprint is the US and Europe, as they've been core areas we've been going to really implement and deploy this technology. But we've been able to, deploy this in over 800 hospitals around the world. This year alone, we'll be adding another 200 to 300 operating rooms that are digitally connected now through Proximie. We have done over 80,000 kind of cases. We've got, I want to say, over 100 terabytes of surgical video data that's sitting in a secure, compliant platform that we are now able to leverage to better extract insights that we can co-develop with our health system partners or our med device partners to translate that into either, better training, better quality and safety, better productivity, and even accelerate R&D and deployment of new technologies in the OR. So it's been amazing to see the network effect and how we've been really leading this category and how you implement and scale. Because as I'm sure you know, with your experience, it's one thing having great ideas. It's a very different thing actually implementing them at scale. And that's not something you can sort of back into. You would have had to set up your underlying infrastructure in a particular way to be future-proof for leading technologies. You would have to set up your team operationally to do that, your SOPs, your processes, your value proposition, all of those things we've been thinking about, scale from day one. And because we started as a global business, I think we made all those right decisions for global scale from day one, particularly when it comes to the technology stack as well.
No, that's fantastic. And one of the things that you and I are both very familiar with is working on making healthcare and access to healthcare easier and more equitable for everyone. But one thing that I found so unique about your story is that you haven't stepped away from the actual practice of medicine. You're still practicing on a regular basis. If I remember correctly, just last week when you and I were
That's right.
chatting. So how often are you in the OR these days, and how are you balancing that with running Proximie? And I have, a couple follow-ups from that as well.
Yeah, I mean, I always get asked that question because I think there's something really special and humbling about still, practicing. There's an intimacy of understanding the environment I'm trying to disrupt. When you're in there, sitting with patients, talking to them about their needs and how you can help them, it definitely generates a lot of, I feel just very, very privileged to be in that position. And there's something very, very satisfying about that. Being able to then work in an environment where you're able to do that with patients, but then bring in technologies that from firsthand experience are going to change the way we deliver care, I think is really powerful. And when I talk to my peers or health systems or colleagues, they don't see me as like a tech provider that's just trying to tell them how to do their job or trying to bring technology in. I'm one of them. I'm on the front line with them. I'm on the shop floor with them. We're addressing, backlog, we're addressing patient waiting lists, we're addressing complex cases, aging populations, supply, demand, all the same components. And I think that makes me a better entrepreneur as well, because I'm able to take those firsthand experiences and iterate and move the needle with Proximie a lot faster, where there's that kind of closeness and proximity to those challenges. And so there's a real beautiful sort of synergy of those. And everything I basically try to do in the hats I wear comes back to one purpose, which is improving patient access, quality care, and making sure they get the best care the first time, no matter where they are in the world. And I love that. I mean, today I still operate. I do clinics, several clinics a month, several operating lists a month. I still take call. I think there's nothing more humbling than doing it on call and having to go in at 3 a.m. To do a case. And I've been very privileged to be supported by an organization that lets me wear both hats. They kind of see me as an entrepreneur in residence as well. So it's been really a joy, and I love every part of it. I think the entrepreneurial hat makes me a better doctor. The physician hat makes me a better entrepreneur, and that's for me. I mean, there's not a one formula fits all, but I think that for me is the best formula at this stage.
And then I want to talk about a third hat of yours, which is as being a child or a citizen of many nations. For those of us like yourself who've grown up in the US, but grown up also outside the US, we tend to focus on what we've seen and what's personal to our situation, which obviously you did in a large part. But your experience certainly gives you a global perspective, both from where you've lived, what you've seen, where you've practiced, where you've traveled. How do you think we're measuring up if you're looking at it from a Western perspective? Because it sounds like a lot of where Proximie is today is US and Europe. From US and European healthcare systems, how are we measuring up? Are we moving in the right direction? Are we doing as much as we could be?
That's a great question. And I think it's, sometimes we have a privilege of having that global perspective because it just gives you can see it from many different lenses. I remember when I was standing on a couple of stages, and this was early on when I was talking about the need for this. People would raise their hand and say, yeah, but that's kind of like charity product. Like that's for, missions and the global South. We don't have that problem here. That's kind of for that part of the world. I remember someone distinctly saying, that's not a problem in our part of the world. It's a problem in that part of the world. And I remember like arguing fiercely that is highly incorrect and that someone should check their facts, because no matter where you are in the world, and I've traveled to many countries and looked at healthcare systems across the globe, we have very similar challenges around access and demand, challenges around workforce, productivity, quality, and safety. And those, of course, have been exacerbated by, challenges like the pandemic, but we see that continuing to be an issue. Now, there are different things that are done well and less well in different countries. No one country has it perfect, but there's definitely areas where the US is an outlier, where you see the spending on healthcare, like the percentage of GDP in the US is close to 18%, whereas the OECD average is about 10%. So there's a difference. And despite that, we're still seeing challenges around, life expectancy rates changing, mortality, high suicide, and these are in high income countries. We also see in certain populations where they have a more aging population, and obviously the US has that, is around, high rates of chronic conditions and lifestyle issues that are leaning into, and we're seeing the sequelae of that later on in life, things like obesity and others. So I think there is still, there's some things that are just common across the board, but there are some things where because of the population phenotype and genotype and what's happening, we see, different components of that. I think affordability continues to be a challenge around the world, but it's definitely an issue in the US as well. But the brighter spots are that we're seeing the adoption of technology in those same environments accelerate. Definitely the adoption of digital technology in the US has been, accelerated versus other areas. We also see the US doing a lot in research around cancer prevention, breast screening, colorectal screening, all of those components, which I think are critical. And I think where we are working, where we felt we can kind of lean in, particularly in the US, is, you've got great infrastructure, huge hospitals, people that have a huge appetite for digital innovation that are willing to take a bet on where the future is going. Because there is absolutely no question in my mind that every single operating room of the future will be digitally connected, smart, intelligent, data driven. And so we've been seeing a lot of that as well. That being said, what's been exciting to see is also other parts of the world leapfrogging the West. And we've seen this historically with the banking sector, with things like M-Pesa in Africa, and Proximie is deployed extensively in Africa as well, through our global health mission. So we do a lot of work with NGOs and organizations in Kenya, Tanzania, Ethiopia, and other places to look at how digital technologies like Proximie can really enable safe delivery of care. So a particular project, for example, happening in Kenya is looking at how through Proximie, we're enabling the safe delivery of babies because they have a high, unfortunately, mortality rate around obstetric complications. So, we see both sides. I think no one country has it fully solved. The UK is the same. I think we have some of the things that I love about the UK system, and I'm so proud of working in the NHS, is the fact that everyone has access to care, irrespective of their socioeconomic or financial position, that sort of like equity of access. But undoubtedly, we have also issues around cost, scalability, deployment, and I think technology is going to make a big difference there. So just some sort of perspectives, but I think to your point, I love that I get to see it from so many different lenses, and I think different countries are getting bits of it right, and bits of it still need some improvement.
No, that makes sense. As you talk about how the future of the OR is going to be that digitally connected space so that people can be more efficient, learn faster, get their reps in more, quicker, if you will. How is Proximie using telehealth and video to bring more physicians into the OR with the on-site physician? Just for those who haven't seen it in action, I know you guys have some fantastic videos that describe it for the layman, but again, in the OR, if I was going to walk in and say, hey, this is a Proximie connected room versus a typical OR, what would I see different? How would it work different? What would be the benefits for the average surgeon?
I mean, a couple of things. First is you would see very little from a kind of hardware because it's a very low hardware footprint. And we do that on purpose because the real estate is so precious in an OR. You don't want to add lots of more equipment and kit. We are a software first company. And what we do is we come into operating rooms and we first lean into existing hardware, cameras, robots, imaging systems, and others. But we are essentially an operating system. We are a cloud-based software. You come into an OR and we install it either by adding a few adjunct cameras and screens that are needed, but ultimately also engaging with the existing hardware. And what we do is we really are trying to drive optimal performance for every healthcare organization. So what does that break down into? It can break down into telepresence and collaboration. It can break down into media capture from devices and from the views of the room to better understand and learn from those. It can break down into digital insights. How can I understand the workflow in my OR? What is the setup time, turnover time, patient exit time? What are the steps of the procedure that were done? What is the accreditation component to that as well? So we are essentially like an infrastructure play, and then we have different apps on it that unlock value for different stakeholders. In some cases, we work with big strategics where we're able to feed back remote support for their service engineers, or we can give them device log data about when the devices have gone down. We work with new up and coming robotics companies that are trying to accelerate the adoption of their techniques. So we have an SDK that we deploy into that. So what you'll see is basically a digitally connected OR, where you have a screen that has lots of different views. You're connected to whoever you want to engage in that environment, and you're tracking and capturing all that information that is owned by the organization to unlock value both clinically and non-clinically, which will optimize performance end-to-end for surgical care. And the other thing probably worth saying is we use the word OR and surgical care as a sort of overarching umbrella, but we mean all procedure rooms. So cath labs, IR rooms, endoscopy suites, procedure rooms, so anything around that. And we therefore are helping systems be more effective in those rooms, drive quality and safety, reduce pressure on the workforce by using ambient data collection to do data entry, and just to develop a just smarter, more effective, better quality operating room.
And when we're in today's world, unfortunately, one of the hard realities is money and cost and budgets. And the powers that be are always focused on hard dollar ROI. So when you're talking to health systems or hospital leadership or the administrators and convincing them of the use case, obviously from the clinical perspective, it's very easy to understand what's happening and how it's beneficial for the actual clinical providers. How do you get the business team and the business leadership on board in terms of whether it's revenue impact, whether it's margin impact, whether it's efficiencies? How does that immediate impact translate in a way that they can understand and justify from a hard dollar ROI perspective?
Absolutely. I think what's also worth saying is because we're a software platform, through that SaaS sort of model, you can be far more, let's say, not as expensive. You're not as expensive for health systems. So they will quickly see the ROI within sort of, months of that. And so it's a great investment for them. But how do we see it breaking down? Ultimately, we have this vision of operating rooms that the sole decision makers around this hugely important, environment is patient and surgical team. But you know this as well as I do. It's not just that, right? It's the administrators, it's the strategics, there are many stakeholders around that room. And so it's really about ensuring ways to unlock value for the scrubs and the suits, if I can call it that, people in scrubs and the people in suits. Because and unlocking value for the people in scrubs is where adoption wins, right? Because they need to feel that they're getting something out of it. And that's why we have such a high retention rate of our users in our sort of platform. You need to be unlocking value around how is this, making my day more efficient? How am I leveraging this to access better expertise or second opinion or training or, engagement with my medical device partner, whatever it might be, not just for doctors, but for nurses as well. And so that whole experience around telepresence and media management and video capture is really helpful. Ambient data collection, so the nurses aren't having to keep going to a computer to say case started, case finished, this instrument was used, that, ways to sort of really amplify and reduce that 30% of, our time is spent on administrative burden is hugely valuable for the individuals and scrubs, if I can call it that. When it comes to the administrators, there's no doubt, their staff satisfaction is critical. Accelerating learning and training. We've shown we can train twice as many doctors and nurses in half the time. We have high NPS scores with our staff, and we surveyed about 5,000 patients who overwhelmingly said that they would feel safer in an OR knowing that technologies like this were powering the OR. So the ROI from a kind of scrubs and patient perspective is clear, and we've published numerous articles in peer-reviewed journals to show that. And when it comes to the administrators, of course, their workforce satisfaction is critical, quality and safety, but also productivity becomes important. We surveyed ORs and looked at ORs, around the world really, and we showed that, there's a good 30% of OR time, 30-40% that's inefficient, it's inactive, it's idle, and that's impacting how we schedule procedures, how we optimize staffing, how we deliver care. So if you're able to work with hospitals and say, look, through ambient video data collection and artificial intelligence, we're able to show you where the gaps are, what the areas for improvement are, and what the potential simulations should be for future, you could easily find ways to add a few cases a week. And I'm saying, like, if you look at a standard, let's say 20 OR hospital, if I can help you just add 1 or 2, I'm being super conservative, like 1 or 2 cases a week through the technology, you've already paid back the software in 1 week. And if you're not able to show how you can accelerate that across the year, not only is there a financial ROI, but most importantly, more patients are getting the care that they need faster. Staff are excited because they're doing more with that time. No one comes to work saying, I really want to sit around for 30% of the day waiting. Like, we all want to operate on our patients. And so you create a better workflow and better quality outcome and financial ROI. And it's very hard to find often intersections that unlock value for everyone, but we've been very intentional in doing that. I think it comes from my experience of being in the OR all the time too, and seeing all those stakeholders. And the final bit I'd say is why people really love Proximie is because we are a platform. And I know it's such a cliche word, and you've probably heard this a million times on these interviews, but we don't want to come into our ORs and log into 7 different apps. I don't want one app for education training, and one for quality and safety and another for productivity, all in the OR. And that is historically what the experience has been in the OR. I want to go to one platform and I want to have all the different value drivers in one place. And I will pick and choose how I use them based on my needs on the day or on the week. And I want all the data sitting in one place as a hospital so I can manage and analyze and truly understand my business in a more comprehensive way. I want all the views of the room. I don't want to just see what's in the abdomen. I want to really understand how we can optimize the delivery of care, optimize training, and bring patients the best care that they need.
No, that's fantastic. In terms of thinking about the training for the surgeons, see one, do one, teach one is a well-known
Yes.
adage in training across the board. How does that translate to what you're doing in terms of see one, do one, teach one, right? From a virtual perspective, and because mentors play such a huge role, especially in all of medicine, but especially in the surgical practice. And how do you convince doctors to be that mentor on a virtual basis? Looking at your own schedule, as well as all the surgeons that I know, they have negative time in their day. So what is in it for the people at the other end of the camera, not the ones in the OR at that moment, but the ones virtually dialing in to be that mentor, that resource, that trainer for the people on the ground?
Really great question. And I often have the slide I put up, which is the kind of see one, do one, teach one, which is how we all trained. And often it's dependency historically on that kind of 3 C's, right? Like co-presence, communication, collaboration. And you'll see all these pictures from like the archives that show like 30 people around a bed trying to see what's going on in the procedure. And that is, that's how I trained. That's how we all trained. But surely we can evolve that to something far more accessible, far more scalable, and one that goes beyond the boundaries of 4 walls of a hospital. And so we coined the phrase prepare, perform, perfect, that we can move away from see one, do one, teach one to prepare, perform, perfect. Prepare means I can digitally dial into any case happening around a subject I'm interested in, either live or on demand because it's recorded. When I'm ready to do my cases, to perform, having a mentor or a coach me through the bits of the procedure that I'm needed for virtually is always, is possible. And we've done studies to show non-inferiority to in-person. But think about the efficiency of being able to just dial in for the bit that you're needed and not have to stand there all day for that procedure. And then perfect. Mm-hmm. Historically, at the end of a case, we'd sit and say, how do you think that went? We'd have a conversation. It's a bit subjective, but we would do it and it was fine and you're done. Now you can go back and watch your performance. You can say, oh, wow, I probably should have been a bit more lateral here. Or you could get feedback. You can do a collaborative review. So you can sit with your mentor on a case and they can draw on the video and say, I probably would have done this differently, or you did really well here. It's exactly what I would have done. This is a difficult case, et cetera, et cetera. So that whole continuum is valuable. And it aligns with our continuum of training education. No one in surgery stops training when they finish their residency. You're constantly training and adopting new skills, new techniques, new devices that are coming to market. So it's a cyclical process. And the more we can create a continuum through digitization, the more scalable it is. But I believe mentorship is critical. And I would say even I wouldn't be here without the mentors who mentored me, both company and surgery. And what's really great is, we're basically taking what has been traditionally done in person or through other mediums like an email or a text to making it more collective and comprehensive. And many of us have sat in a coffee room or texted a colleague saying, I've got this case, what would you do? I'd love a second opinion. We all get second opinions. We take cases to MDTs to discuss them. So it's quite common for us to call a friend and get some advice. And a number of us, and I'll speak for myself, but I'm sure others would admit, have been in a difficult case in an OR where you said, God, I wish I could just have another pair of eyes on this to get sort of an opinion. And so if there's ways in which you can enable that more seamlessly without someone having to leave their outpatient, come upstairs, change into scrubs, walk into the OR where you're delaying this by 30, 40, 50 minutes, where you can just, dial a friend, call them and say, we're doing this case, what would you do? In a more of a discussion perspective, I think it's hugely valuable. So we see lots of mentorship happening, preceptorship, proctorship. We did a partnership with the Association of Surgeons in Training, We're enabling 3,500 of their members to have access to mentorship and proctorship through that. Now, you said, how do we sort of set this up? So what we do is we provide the enabling tech. And that tech enables people to reach out and connect themselves. We don't pair people, we don't match people. We feel that people should find the individuals that they want to work with and mentor, but make sure we provide best-in-class technology to make that experience as beautiful as possible. So that's kind of our approach today.
No, and that makes sense. And a lot of what's underpinning all of that, as you referred to a couple times, is data. And there's a lot of data that you're working with, both audio and video, as well as in the medical record, and kind of data points from the actual surgical procedure that you're recording. What are some of the challenges you've faced, and what is your vision for how this data will be used, especially in this era of all these ransomware attacks, security being such top of mind for any health system, regardless of location? I'm sure you've come up against your fair share of IT reviews and security assessments and all sorts of fun things on that spectrum. What's been your experience, and what can you share?
I mean, this is something we take incredibly seriously. It's actually why we've built the whole stack down to the bare metal ourselves. We don't wrap around third-party technologies. We don't wrap around a Zoom or a Twilio or any of those solutions. Not that there's anything wrong with their solutions, but we believe, we want to really own this down to the bare metal, and we've invested a lot in the infrastructure and security around that. We are ISO 27001 sort of certified. We have numerous certifications that we share with our partners. And we've even gone up to C-Star level 2, which is the same type of security checks as a cloud provider. We do regular penetration testing. We work with our partner hospitals. So all those things in terms of how you structure your dev team, how you structure your core infrastructure, what kind of audits and checks you go through as a company are critical. And we do that regularly, and we share it all publicly. It's all available online. People can see it themselves. And when we work with hospitals, as I'm sure you have, and you have to go through those checks, we've never really faced any major issues, because I think they see that we've been very thorough in that process. You could almost argue for an early startup, we sort of over-engineered it early on, but I would much rather be in that position than the latter. Because once you've done it, it's very hard to sort of walk back and start to sort of redo those foundations again. So we've done that sort of very, very well. And I think that's why we've had such success. So much so that, the UK military has used us in the past. We've worked with very, high stress sort of environments, high security environments, and have been successful there.
What's your vision for how the data can be used? So you've locked down the data, you've made sure it's secure, and both secure and accessible, which is sometimes at conflict. What's your vision for what we can do with that?
Well, it's a couple of things. I mean, one, I think, I'm a big believer in sort of data saves lives. The more we can leverage this information, the data is already sitting there. It's just sitting in silos. We have medical record systems, we have video towers, we have robots, data is being already captured and collected in lots of different bits and pieces and lots of different formats. But no one is really orchestrating it all together in a way that we can truly unlock comprehensive insights. So today, when we think about data, we're doing things around productivity and flow. We're doing things around phase segmentation of procedures to show doctors and nurses the steps of the procedure that they've sort of gone through. Those are really important components. But over time, you can start to see automation and support, co-piloting, generative AI leaning in, things like operation notes and others that we're starting to test out and see how that can, again, optimize the flow and enhance patient care. And so the more we can leverage that data to work with our partners to create those value drivers, I think the more it's going to be a positive sort of cycle within that. And it's going to be the gift that keeps on giving. So we need to work together with our partners. We need to work through the data and analyze it for patient care. And I think it's going to feed back upstream into R&D, because if we're able to better understand what's going on in the OR, how our device is being used, what the needs are, that's going to influence your engineers at the bench side, your R&D teams, to iterate and come up with novel technologies much faster and deploy those to market, which are going to be good for patient care. So we're doing a bunch of projects with health systems around different components of data. But I think surgical data science is just at the start of what is possible. There's incredible labs working on algorithms. And I'll end by saying, you have to approach this with a humility. I think if any one company thinks they're going to solve this all on their own, they need to get it, come spend some time in an OR. But I think if we say, look, we're going to create the tooling, the infrastructure, the piping, the enabling tools. And as we do today, we partner with research labs where we've got incredible postdocs and PhD students that are generating algorithms for particular parts of procedures or workflows. They can bring their own model to the footprint. They can bring their model through the right checks to these centers and work with these centers to deploy them and learn from them in a much better way. We can create sandboxes to test these models in safe and secure ways as well. And that's only going to help accelerate digitization, data, tooling that is going to optimize the care for patients.
And the flip side of that is that there's still variation in surgical outcomes, and that's been well documented. Actually, one of your original motivating factors, right, in terms of both access and variation in surgical outcomes worldwide. And that continues to be a risk factor for surgery, regardless of whether you're at one of the top hospitals in the country or you're at a rural hospital outside the U.S. How does a digitalized OR standardize surgical outcomes? Do you find that it has been able to do that, or is it more about getting the access out, not necessarily about standardizing the processes for that exact same procedure worldwide, for example?
No, I think it absolutely can play a role in the codification of surgery, because if you think about it, if you're able to segment the procedure into different steps, try and understand what people are doing and where they're veering off or what the outlying steps are, this can help with training, education, accreditation, quality and safety, and checks. Now, I'm not suggesting there should only be one way to do any one procedure, but there also shouldn't be 15 ways. There probably are really 2, 3, 4 ways to do a particular procedure, and we need to basically work towards bringing that sort of curve closer together, that sort of the outlying bits. And you can only do that with a single objective source of truth. It's very hard to compare apples and oranges if you don't know what you're looking at. But if you suddenly have a data that's being collected objectively, and that we can automate that sort of segmentation, then we can feed that information back to our clinical teams. It's going to only empower them to lean into that codification or that standardization. We definitely don't want to go around saying every single person should do things only one way, but we definitely think there's ways in which we can codify against our training sort of criteria around surgical procedures.
No, it completely makes sense. One of the areas that I would see as a natural, benefactor, or actually, sorry, start over. One of the areas that I see as a natural area of, sorry, I'm going to back that up one more time, Nadine.
No worries.
One of the natural client areas for Proximie that I would see from the outside looking in is medical schools. So especially for training. Is that a big area for you guys? You haven't mentioned that in particular as one of your kind of key focus areas, but I could really imagine, obviously surgeons need to have hands-on practice, but at the same time, getting those extra reps in, getting that extra practice in, getting more time, like you said, with your mentors in between kind of the scheduled surgeries, especially for the more complex ones or the areas where you want to have practice on the more complex ones, which you won't necessarily get live OR time to watch again and again. Has this been something that's been very interesting for the medical schools and training colleges around the world?
Yeah, I mean, to be honest, what's great about this is Proximie spans the continuum of a surgeon's career, from medical school, where you're able to now virtually reach in and observe procedures as you're assimilating anatomy, anatomical structures, procedural steps. And we work with many medical schools that are doing that, to training residency programs where you're codifying, accelerating the learning of techniques, reviewing your performance, and trying to move through that training and competencies, because competency through video and video logbooks is going to be, I think, the next paradigm. To the medical device industry and the adoption of techniques. We work with many strategics on clinical support for their doctors that are using their kit, for training their sales, their service engineers, supporting them with that data. So it really sort of tracks that whole continuum, which is what I love about the Proximie journey. It's not a point solution. It's something that transcends what stage you are and fits alongside your continuum as a career. And so you become a lifelong user of the platform, which obviously adds to the stickiness, but also forces and encourages us at Proximie to constantly innovate and iterate and bring new technologies to bear whenever possible.
I know that you probably have some amazing case studies and clinical stories you can share. Do you have a particular one that stands out for you, or a patient case that you can talk about that highlights what you're most proud of from a Proximie perspective, or from a personal perspective.
There are so many stories I could tell. We'd probably need 10 podcasts to get through just a fraction of them. I sprinkled a few of them in the discussion, but
Yeah.
probably let's share some vulnerability here, which I think would be good. So I'm going to tell you a case. So this was a 57, 58 at the time, some years ago now, patient who unfortunately had suffered complications following a laparotomy she probably shouldn't have had, but it had it done. And was left needing to be fed through a tube for a long time, had a fistula, was in intensive care, almost bled to death twice. I mean, the story went on for years. And eventually, it all kind of healed up, but she was left with a really awful abdominal wall hernia, which basically is sort of dysfunction of the abdominal walls. Every time you cough, sit up, whatever, everything sort of bulges in and out. And she would get into, bouts of challenges where she'd have to go in and out of hospital, things what we call pseudo obstruction or obstruction. And it was really just not a great quality of life. And so the local team that was looking after her and sort of addressing the challenges she was facing said, look, this is really complex. You might want to go overseas to this particular hospital, which are like the experts on, this abdominal wall dysfunction. And she said, no, I trust you. You're my team. You've looked after me. You've gotten me through all of this. I trust you guys and I want you to look after me. And I want to be in my country around my support network, my family. I don't want to be a stranger in another country on an intensive care unit where I barely speak the language. So she said, but I've heard of this great technology, Proximie. We could have an expert dial in and you could work together through the case. Would you be open to that? So the surgeons were great. They obliged. They were happy to bring the technology in. We had the other experts dial in, and it was really more not one expert telling another what to do. It was camaraderie. It was collaboration. I mean, they're both very, very experienced general surgeons. They were talking through this case and working through it. And at the end, she had a great outcome. Went home, some days later, and literally that summer was at the beach with her grandkids, lifting them, swimming with them, playing with them, living her absolute best life. And that patient was my mother. Bringing that to when you sort of when they say you're backing the technology yourself, I absolutely am. Like my own mother has had surgery with Proximie and is our number one ambassador, and I think that I hope convinces also people listening and the public that we truly believe in what we're delivering, and we're seeing the impact at every level in the world, and at a personal level as well. So really proud of that story, but there are so many other stories like it.
No, it's amazing. I had chills. Like when I could kind of see where it was going as you got further into it. I was like, oh my gosh. Well, one, I'm glad she had such a good outcome, even though it started off maybe less ideal than you would have wanted for her.
Of
And the
course.
fact that you were able to be such a part of that story is I'm sure, one, very satisfying for you, but two, just a great testimony to what can be done across oceans to get patients the care they
Absolutely.
need. So it's fantastic. Well, I know we're coming up on the end of time. Thank you so much for sharing your afternoon with me and telling us more both about what motivated you to start Proximie and what Proximie is able to do for patients needing access to surgical care when and wherever it's needed. So thank you so much, Nadine, for both starting the company and for sharing the story.
Thank you so much. I've really enjoyed this, and congrats to everything you're doing. It's pretty awesome too. So I'm excited to have a fellow female CEO that we can share notes with together. So let's make sure we do that offline.
Same here. Would love to.